First, really sorry to... All right, and for those online, I guess we have people online. Yeah, Margaret?
We do.
Sorry to keep you waiting, folks. Sorry, Margaret, over to you.
Welcome, everybody, to this press conference to hear the findings from the joint mission, the WHO-led international expert mission, a joint mission with the Chinese government to investigate and look at all the issues around the coronavirus outbreak in China. We have, as you, needs no introduction, Dr. Bruce Aylward, who led the mission and is fresh off the plane. You wouldn't believe it, but he is. And just a little bit of housekeeping. For the people on the line, if you dialed in, when you ask your question, dial *9. Or if you came in via Zoom, raise your hand. We'll have questions after Dr. Aylward gives a preliminary presentation, and then we'll go into questions. Over to you, Dr. Aylward.
Thank you very much, Margaret. Could we get a jug of water, a glass of water, please? Sorry, I'm getting rather hoarse. Thank you. So again, really apologies for keeping you all waiting, but I just got off the plane and it's been a rather frantic little bit of time trying to get a few things finalized before I spoke with you. So what I wanted to do today was, as you saw yesterday, I gave a press briefing in China. It was rather long and would have taken you a little time to listen through. I'm not sure everyone saw it. So what I'd like to do is summarize some of the big points a little more quickly than I did yesterday. But if there's specific points people want us to dig into after, I'm happy to do that. But what I thought might be most useful for the press today is if I spoke to three big questions, which are around the issue of, what has China actually done in terms of the response and how have they done it, which is a extremely important to where we go next with this, let's say. The second thing I want to talk a little bit about is what the impact of their approach has been, and then finally to some of the implications as we go forward. So I'm going to touch those three big questions. I might spend a little bit of time on each. Just before jumping into that, I think as most of you know, the genesis of the mission, it was a request or a decision actually by the president of China in a meeting with Dr. Tedros with a joint feeling that China had done a huge amount of work and it could inform, let's say, both the global response as well as China's own response to have an independent mission come in and have a review and an assessment of what had been done and lessons for the way forward. So we put the team together, and in the end it constituted 25 people. There were 13 internationals headed by myself, and then there was a team from China. I shouldn't say a team, there was a group from China that were part of the team because it was very much an integrated team of, so 12 from the China side. People, maybe I know there's been a lot of interest of who was actually on the team. There was, in addition to myself, from the side of China leading the response was Dr. Liang Wenyan, who anyone involved in the response there will know. He's the head of what's called the expert group in China for the coronavirus response. So he was my counterpart. And then we had, from the international side, I'll just run through, we had Tim Ekmans, who's with the Robert Koch Institute in Germany. We had Dale Fisher from who's actually the chair of the Gorn group right now and is a professor at the National University of Singapore. We had Chikwe Ihekweza, who many of you will know is the Director General of the Nigerian CDC. Cliff Lane, who's a clinical director at at NIH in the U.S. We had Jung Koo Lee from the Seoul National University College of Medicine, and Dr. Lee, some of you may remember from the MERS outbreak in Seoul. He actually led that response. And then we had Gabriel Leung, of course, the Dean of Medicine from the University of Hong Kong in China. We had two participants from Russia, Alexander Semenov, who's the deputy director of the St. Petersburg Pasteur Institute, and Natalia Shenkinyaya, who is the head of the international department and infectious diseases in the National Medical Research Center in Moscow. I'm reading from this to make sure I don't forget anyone, actually. Hitoshi Takahashi from the National Institute of Infectious Disease in Japan. Maria Van Kerkhove, whom many of you know, usually sits to the left of Dr. Tedros, I believe, during the briefings that WHO does on the evolving epidemic. And then we have from the international side also Weigong Zhu from the Centers for Disease Control in Atlanta. And if I remember correctly, that was it from the international side. And we'll put the list up of the internationals as well as the national experts from China's side so that everyone has access to those. Maybe just a couple of words about what we did. As you may have seen in the press conference yesterday, we started in Beijing. I was there for a week beforehand, arranging the mission, looking at a lot of the preliminary data, et cetera. And then the full team arrived on Saturday. We spent Sunday getting ready and then kicked off Sunday evening. And just to give you a sense of how the work is being done in China right now, much of the team and the ministries we needed to work with were very, very engaged actually on Sunday. And so the meeting actually kicked off at 7 at night and we worked till about midnight and just after midnight with multiple ministries. And we had Wuhan on a video conference for a couple of hours of that as well. And that was quite typical of the working days, quite frankly. So if I ramble a little bit in various directions, folks, it's because of some pretty severe sleep deprivation right now. So apologies for that. So we started there, and then we spent about just a day then in Beijing, meeting with some of the national institutions as well as the Beijing municipality to understand how they worked. We looked not only at the national level, the municipality level, but then we were right down to the community level to try and understand how things actually operated in terms of case finding, contact tracing, and also to speak to a lot of physicians, contact tracers, really to get a feel for what was working, what wasn't working, how things had evolved over the last 6 or 7 weeks. From there, the team went in two different directions. One part of the team went to Guangdong province, and then that's a very large industrial province, you may know, just bordering Hong Kong. And then another part of the group went to Sichuan, and then from Sichuan joined the Guangdong group, and then part went to Wuhan, myself included, for a day and a half, just toward the end of the mission prior to the wrap-up and then the press conference in Beijing. So we actually covered a fair amount of territory. In every place, we saw facilities, we saw contact tracing, we even saw markets in a couple of places. We saw the railway stations, the airports, the, gosh, what didn't we see? Clinics. But we really, it was quite an exhaustive and exhausting schedule. And as I go through this, I really want to pay tribute to the people in all of those places, because we asked hundreds and hundreds of people, probably thousands of questions, and often the same ones again and again from different directions, to try and triangulate a lot of information to really understand how robust it was. And this is really important in a crisis like this one, because as you'll understand, we're only, when I started there, 6 weeks into this. So they've been moving very, very fast. People were exhausted. Huge amounts of things have been done. Things were changing very, very fast. So trying to accurately build what had happened and how what it looked like took a fair amount of time. And I just want to pay a tribute to the team, yes, but especially to the people who spent so much time in the middle of this doing it, because they were really shattered and doing and had the important life-saving work of running a crisis response. I also want to clarify, by the way, just as we kick off, and I'll get into the issues right now, I promise. I'm speaking for the mission here as the team lead for a mission that was independent of WHO. I've actually not briefed Dr. Tedros. He's actually not seen the report. This report is from the team and represents work done by the team together. The last a couple of days was our Chinese counterparts, internationals, working very, very closely together in small groups on a lot of different issues to nail a lot of this down. And so the report's just being submitted. I had to do some final edits. That's what took me late now, just being submitted right now. So let me run through those three big issues that I said. So the first was, what did China, what have they actually done? And what they've done is as I mentioned in the press conference yesterday, they've approached a brand new virus that's never been seen before, that was, as you know, escalating and quite frightening in January. And they have taken very standard and what some people think of as old-fashioned public health tools, very basic public health tools, and applied these with a rigor and innovation of approach on a scale that we've never seen in history. Basically, they have taken case finding, contact tracing, social distancing, movement restriction, and used that approach to try and stop a new emergent respiratory-borne pathogen. And as most of you know, for flu planning, etc., most of your thinking is buying enough time to get your vaccine rolled out to try and reduce morbidity and mortality. And here there was no vaccine, there was no therapeutic, and the Chinese took a very pragmatic approach and decided we are going to go after containment of this virus using that set of tools. And a lot of people in the world, and I have to admit myself included, and certainly a lot of people on the team, would have been very cynical is the wrong word, but maybe concerned as to whether or not you can truly stop that kind of a pathogen, because it runs counter to thinking. A respiratory pathogen, you could actually find the cases, isolate the cases, do the contact tracing, and achieve that kind of an outcome. But what China did was they took a very, as we dug into this, and it took some time to understand it properly, they took a very systematic approach, and there were 5 key things that they did in applying this that were some of them different, but all of them impressive and critical to making it work. So the first thing they did was they took a differentiated approach, because they realized immediately, if you try and do, and when you think of China, people often think about the lockdown in Wuhan, right? Which is a giant city of 15 million people. But that was just in Wuhan. In other parts of the country, the fundamentals were always the same, but then the degree of application was different, and it was tailored to the context, the setting, the intensity of transmission, et cetera. So the first key thing was this differentiated approach. If there were 0 cases, sporadic cases, clusters of cases, or community transmission like they had in Wuhan, the approach was differentiated. And that was important, because a lot of people say you can't do this at scale because you will exhaust your response. And I've heard that a number of times, people saying, oh, we have to switch to another mitigation approach or whatever because you'll exhaust. But the Chinese pragmatically said, not if you tailor this properly. The second thing that they did was they mobilized a phenomenal collective action and cooperation by the people of China to this response. And the interesting thing is, people have commented on that and say, oh, that's easy in a society or a political system like China. It isn't. It's never easy to get the kind of passion, commitment, interest, and an individual sense of duty that it's our duty to help stop this virus. I mean, we spoke to hundreds of people in hotels, on trains, and planes who are quite outside the system, and they all shared this sense of responsibility, accountability to be part of this. And the most stunning demonstration of it was when we pulled into the train station at night and it was a special train, because right now, I mean, it's the saddest thing. In Wuhan, the trains roar right through the station. I mean, continually now for a month. the big inner city trains, they roar right through with the blinds down. And if you're living in the building surrounding them, watching them, and people accept that there. But we're the only train that stopped, so that, 6 of us could get off that train and be part of this. And as I got off, by the way, another group got off, and I said, well, hang on a minute, I thought we were the only people allowed to get off in Wuhan. And this was a group that had these little jackets on and a flag. It was a medical team coming in from Guangdong to be part of the 40,000 healthcare workers from other parts of China that have come in, many of whom volunteered to go into Wuhan and help with the response. But the level of collective action, and the striking part when you pull in, is you pull into the city of skyscrapers and massive boulevards, and this is not a village. This is a city of 15 million people, a modern city. And as you drive into the city, in the dead of night with the lights on, it's a ghost town. But behind every window and every skyscraper, there are people cooperating with this response. And people have said, yeah, but there's a big presence forcing them. There isn't. Invisible. It's staggering. And every person you talk to there has a sense that they're mobilized, like in a war against this virus, and they're organized. So that's the second big thing, this collective action. The third big thing is they've repurposed the machinery of government. And I often hear people talk about an all-of-government approach, and I never know what that means. But then when you see and you hear from China, they have repurposed. Transportation does this. They run the trains this way. They manage the roads that way as part of the response, and the toll booths and the checkpoints, The agriculture does this. The forestry folks do that. But everyone has a role, and it's been repurposed to fit into this machinery. And it works through a prevention and control task force that answers straight to the state council and president to run the whole machinery of government in support. The third thing that was really, or fourth thing, pardon me, was it's a technology, what's the phrase? Turbocharged response. They are using big data and AI in places. I guess people have got a sense in China, nobody uses money. I couldn't pay for anything. I took money out, and it gets difficult to pay because everybody pays with WeChat on their phones. They used to pay for everything, and life is lived online, big chunks of it. And from a distance, I hadn't appreciated that. But what they've done is, when it came to the response, they had to manage massive amounts of data, massive numbers of contacts, because remember, they were trying to find every case, trace every contact of 70,000 cases across vast areas and know where they were, follow them up. So you manage all of that data. And then you've got to be able to map that, link it to other sources of data, et cetera. So that was one piece of it. But the second thing they had to do was, because of the sheer numbers, you had to take whole hospitals and take them out of general service and make them basically response hospitals for COVID-19 cases, which means you've taken major hospitals in a city and you've repurposed them, multiple ones, for this response because there are so many cases. And people would ask then, well, what about all the regular patients? So they kept some designated patient hospitals, obviously, for regular services. They delayed a lot of things like elective surgeries, et cetera. But then a whole chunk of work, and someone in one place said 50% of their consultations are now done online. They just moved a whole bunch of what was normally done physically online to be able to keep the regular health services going, prescriptions turned over, et cetera, in a very orderly manner. And then the final piece, of course, was just everyday life. You have to feed 15 million people. You've got to keep the food moving, all done through deliveries, all made online, et cetera. I talked to some people and said, well, how does that work? And they said, well, every now and again, something missing from a package, but I haven't lost any weight. That's what she actually said to me. One of the people I asked in Wuhan. And then the last piece of this, which was equally impressive, was how science-driven the response is there as well. Because remember, we've known COVID, and it sounds like we've been living this forever, but this is 8 weeks. We're 8 weeks into this. And the science has evolved so fast that China has had it's issued, well, we were there. They issued the 6th set of clinical guidance, how to take care of the cases. And imagine that. I mean, you know how long it takes for WHO to generate a guideline, right? And then you try and get it out and get people using these things, the same in every country. Here they had turned over the national guidelines, how to take care of these severely sick patients, 6 times by 6 weeks. Every single one of the places we went, we asked them how they're managing patients. We're using the 6th guideline. I mean, how is that? It came out yesterday, but and so there's this speed of turnover to try and stay on top of the learnings on this. So it's a science-driven, very agile response as well at a phenomenal scale. So what they did, again, it sounds so easy, right? Oh, they did case finding and contact tracing. Well, they did this in an extraordinary way with an extraordinary rigor of application and discipline, and differentiated approach, incredible collective action, repurpose the machinery of government to make it work, technologically powered and science-driven. And they applied that then to what was an escalating, remember the exponential growth of the disease that you were seeing and in places. Remember, every place it's hitting these days, you're seeing exponential growth again, right? And so, and most people, you keep hearing the debate on TV about, and everywhere, which fascinates me, you know, is this a pandemic or not? Folks, this is a rapidly escalating epidemic in different places that we have got to tackle super fast to prevent a pandemic. I mean, it's actually, what China demonstrates is where this goes is within the control of our decisions to apply this kind of rigor and approach to this disease and its outbreak. And you saw yesterday, some of you will have seen this, and I brought it along again today, because we get to the second question then of, okay, great, we understand the approach now, and that took some time to understand it and understand how does that actually work at you know, each level. And that was another big learning. I mentioned it in the differentiation part, but what was interesting as they went through this was that there was a lot of latitude. Like the big rules of the game were in place, but provinces, counties, you know, towns, they could adapt it as they needed to be able to make it work for them. And so as you went from one to another, the fundamentals were always the same. You know, you're tracing contacts, not cats, right? I mean, the fundamentals are the same, but they were adapted to be able to work for that specific area. By the way, someone asked me once, they said, okay, we've seen the big cities, but what about the rural areas? What was happening there? And while we were in Sichuan, we looked at that, and this comes back to the technology part, went to the operations center and said, well, how is that working? And so they had teams out there all over the place that were doing the case finding, investigations, contact tracing. But, well, that's great, but how do you know how it's working, et cetera? And they have standard indicators to trace all that stuff. But they said, well, we made a decision in Chengdu right at the beginning. The governor explained this to me, that as we rolled out our 5G platform, we were not going to prioritize Chengdu. We were going to use this to make the connectivity with the rural areas work so we could run the COVID response basically in real time. And so when we were in one of these places, we went to the operations center, and they'd had a new cluster, and they had mapped out. So they had one big screen on the wall that had the transmission chains mapped out, and there was a problem with it, and I asked something about that, and they said, we can speak to them, and they pulled up on the other side the operations center in this county, and so we talked to them about what they're finding and the rest, which took a while, and then again there was a question, so they said, well, hang on a minute, and then they pulled up another screen, and there was the team that was out in the field actually trying to do this, but the whole thing is linked up, and they're in constant contact trying to make sure that together they solve the problems of trying to sort out the transmission. So the question then was, okay, well, what's the impact of this? Because there has been, you know, obviously this is happening elsewhere, this exponential growth, and as I said yesterday, it's the unanimous assessment of the team that they have changed the course of this outbreak. What was a rapidly escalating outbreak has plateaued and then come down faster than one would have expected if we had looked at the natural dynamics of an outbreak like this. And that's striking. And so what I showed yesterday was this graphic here, which I think is really helpful, because what you can see here, if notwithstanding this reporting spike here, but what you're looking at here is what you call a exponential growth, right? Growth rate here at the beginning of this curve going up like that. And if you look at this side, you can see it's actually coming down more slowly, because what happens, what would happen with an exponential growth is we go up and up and up like that, and then you would see a normal distribution and it would come down like that. That's a normal, I mean, you've seen these normal distributions, right? That's what would happen if it runs through a community. But when you start doing all of this, which are the interventions, then you can, ideally try and change the shape of that. And that's what China has actually done. To my surprise, and it was one of those things that, when you spend 20, 30 years in this business, it's like, seriously, going to try and change that with those tactics? And yes, and it was successful, or it is being successful, because look where the cases are driven right now. And one of the things we looked at was, okay, well, if that curve would go like that, big question mark, how many cases have been prevented or at least delayed as a result of this action? And, rough back of the envelope, we look at it, it's hundreds of thousands of people in China did not get COVID-19 because of this aggressive response. And any time you pull down the force of infection from the epicenter in an outbreak like that, you are going to reduce the probability of it going elsewhere as well. And that was the other big thing we heard again and again from anyone in China was, it's our responsibility to do this for the world, not just for them. So we heard that quite a number of times. So the question then became, okay, because we'd heard before getting there, of course, is this real? And one of the comments I made yesterday was, we know the numbers have bounced around as they've gone down, and people have asked questions: what's going on today? How come the numbers have gone up, etc. And what we as epidemiologists are interested in is not the exact number on an exact day. We're interested in the trend, and you want to know, is that trend real? Is this going down? Is it stable, or is it going up? Because there were questions about things aren't being shared, etc. And so when we dug into that, we looked at, there's multiple different ways you can try and get a sense of where the trend is going. And one thing you can do is you can talk to doctors who are seeing patients, who are running these massive hospitals. And, everywhere you were hearing the same thing, that, we have open beds. And in Wuhan, it was like, we have open beds. We can get people out of, isolation centers and into a proper hospital bed. We're able to, the system is opening up because the number of cases are going down. One indication. Another one we looked at was they've established what they call fever clinics. And these are places where if you have a fever, you go and they assess you, and they do a CT scan very quickly. They do to see whether or not you've got the telltale marks of COVID-19 disease, and which is an amazing story in itself. But and then at these fever hospitals, then a decision is made. They do the test, whether or not you need the test, and then they do the test, and then whether or not you need to be isolated in a facility, et cetera. So another thing we looked at, well, how many people are getting tested? Because what's happened is, as people have, this mobilization of the community has happened, there's been more and more people who want to be tested, quite frankly. And so they've been going and getting tested. The numbers have been going up and up and up in terms of people getting tested initially. And at one point it peaked at about, I think, 46,000 people were being tested almost daily across the country, huge numbers. And then it's down, when we looked at about a week and a half ago, down to 13,000. It was going down like that. And when we went and talked to the people at the fever clinic, they were sitting there not scanning people or not testing people, and they said, this is a change. We had lines and they aren't there anymore. And that's the second indicator that is real. It's coming down. And then a third indicator, which was interesting, I spoke to, again, I mentioned this yesterday, so sorry to be redundant, a fantastic researcher, a man called Xiao Bin, who is running a remdesivir trial on severe and mild cases in Wuhan. And it's being done in Wuhan, of course, because that's where you have the highest number of cases, you get the fastest enrollment, and we try and get an answer on this interesting drug as quickly as possible. And so when I was talking to him, I said, so how is enrollment going? And he said, it's a challenge. It's slowing down. It has slowed down because there are not enough new patients that we can actually recruit into the trial. So, this all comes back to that question of, is this real? Is what I described to you, this extraordinary mobilization to implement fundamental public health principles and approach in the absence of a vaccine or or drugs, in the presence of a respiratory disease, can this bring this down? And it can. And that's the core message, right? We're getting new reports daily of new outbreaks in new areas, and people a sense of, oh, we can't do anything, and people arguing, is it a pandemic or not? Well, sorry, why don't you go look at, have you got 100 beds where you could isolate people if you have to? Have you got a wing of a hospital that you're going to close off? Have you got 30 ventilators, because you're going to have to help keep the severe cases alive for, they'll recover, but they're going to need to be ventilated for 4 or 5 days or a week. Do you have those pieces? Do you know who your 1,000 case, contact tracers are? There's really practical things you can do to be ready to be able to respond to this. And that's where the focus will need to be. So we looked at this and said, okay, that first question I told you about, what was done. The second, what was the impact? And the impact was striking. Oh, I showed yesterday another graphic, which might just be useful for people, because in some ways this is more striking than the national one. So what you see here, this is the same as the one you just saw. These are the data for all of China, right? So going up fast like that, up, abrupt plateau, and then this skewing as it goes down, rather than up like that, a bell curve, and down out like this. But then if you look at, and you can see this is Wuhan right here, which was really driving the main shape of that. Then these are the other areas of Hubei, and this is China outside of Hubei. And remember, there's a lot more people who live outside of the province of Hubei than live in Hubei. But this is a much smaller curve, number one. The other thing, the shape, it's a very flat curve as well. Part of it's a scale, but this is not the shape of a normal epidemic, and that happens when you do something to try and change it, which is what China has managed to do. And what's striking is how far down they've gotten it. If I remember yesterday, someone told me, I've heard so many figures. I think I've heard more figures than there are people in China over the last 2 weeks. But I think one of the figures I heard yesterday was that 0 out of 24 provinces had reported 0 cases for a day. And that's, remember, there were 31 provinces infected only 3 weeks ago. Again, evidence, and all of these are as big as any one of the countries that have been, in the news recently with their outbreaks. And that's a very hopeful thing, which brings us to the third thing that we were looking at is, okay, where do you go next with China? Where do you go next with the this in terms of the global response? And one thing to mention first is that China were not acting from scratch. China had the SARS epidemic, or an outbreak rather, remember, in 2003, and they realized they had to set up surveillance for atypical pneumonias and other surveillance systems, that they needed to be able to do case finding and contact tracing, at a much larger scale, et cetera. So they had time and experience to build a system. But in terms of where they go next in China, and having seen so much of what they had done, it was a little bit humbling to be asked for opinions about, okay, where we go next. And a lot of it was really reinforcing what China is already doing. And the first piece of it is, the vigilance. Cases are down, but they're not 0. There is still a lot of disease in the country that's got to be dealt with. And remember, the people who get sick, they remain in hospital or in an isolation center for anywhere from 2 to 6 weeks. So it's a long period of time. So if you have all of these people that got, actually, let's use this one. So if you have all of these people, let's go back a few weeks. So if we go back 2 or 3 weeks, right? So you're back here. If you have all of these people that were sick at that time, and you've got to add some of the ones who were sick, because that's just who were sick on that day or that week, remember. So then you got to add the ones before. So an awful lot of those people are still in hospital or holding center, an isolation center. So right now, the number, if I remember correctly, yesterday was just over 50,000 people are still recovering from COVID-19 across China. But one of the other things we learned, though, is the spectrum of the disease. There's been a lot of question about, okay, what is really the spectrum of disease that this causes? What's the natural history of it? And we got a lot of information there because of just the sheer numbers now. And as the epidemic or the outbreak goes forward and they start to get control, there's time to analyze a lot of that information more clearly. So now they can generate, and this I take absolutely no credit for, this nice piece of work. But this was done by the Centers for Disease Control for the report. And what they've done here is try to help people be able to visualize, well, what proportion are mild or common when they're found? What proportion are severe, and what proportion are critically ill patients? And I think you have a sense now, like the mild cases may just have a fever and a cough, and by the time you get to the common, they usually have a pneumonia and they're a bit sicker, but frankly, they're still mobile and in good shape. The severe are the ones, by the simplest way to say it is the next step is they usually have a respiratory insufficiency of some sort, like their oxygen saturation is going down, their breathing rate is going up, etc. And then the criticals usually have by then often multi-organ failure. And what we're able to see from this is, okay, what proportion fall into each group? And you can see 80% are mild. And of those, and a really important insight from China is, well, how many of those will go on to severe disease or even death? And you can see from the milds and the commons, very small proportion. This is really mild with pneumonia. With severe or larger, and the worst outcomes, of course, in the critical. But now we're getting to the sheer weight of numbers that help us understand that. And that's really important because you've got a plan. How many beds might you need? How long are you going to need them for? What are the outcomes going to be like? How many are going to become severe and you're going to need possibly ventilation, et cetera? These are really important things to be able to plan that. Also, if you want to plan a clinical trial, you need to understand, well, would they get worse without the drug or not? Would they go for it? So you need this kind of information is so important. And China right now are the only ones who have been able to generate with the kind of numbers to be able to help us understand that. But what it means is they still have 50,000 cases, as we mentioned. The thing is, any new cases now, they generally know where they've come from. They can link them epidemiologically or link them to a contact, and that's when you know, as you heard from Ebola, that's when you know you're getting control of a situation. You're not getting cases from out of the blue and you can't link them back, which is what's sometimes so concerning. So that's the first thing. The second big thing, which is a really important message from China, is every governor we talk to, that most of them, they had an epidemic curve that was going down like that. And what were they doing in response? Building hospital beds, buying ventilators, and being prepared. That's what they were doing. They were saying, okay, look, we just repurposed hospitals that should be giving general care. If these cases go back up again, and that was always what they came back to, we don't know this virus. People are talking about SARS or they're talking about flu. And as soon as we get stuck with that two binary, approaches and ways of thinking, we're not preparing for the novel coronavirus. We're preparing for that or preparing for this, but we're not using all the evidence that we have. And one of their key points they made again and again was, we don't know what's going to happen next in China. We've got it right down like this. We think we can manage, and there will not be another Wuhan. We know how to manage this disease now in all the parts of the country. If it went to zero and disappeared, that'd be great, but that's not what they're planning for. What they're planning for is this could remain for some time, maybe some time till there's a vaccine. So we will have the capacities to be able to manage it and run society and economy and everything else the way we need to, and not lock people down to try and manage this. So that's the second big thing they're doing. But it's a good message for the world, right? How many countries are planning hospital beds, planning ventilators, planning O2 supplies, and the lab capacity to be able to manage this? And then the third thing that we said and asked of China, at this point, the world needs the experience of China. China has dealt with the most disease in the world. 31 provinces have managed this. Everyone we spoke to, they knew what they were doing, and they've clinically managed huge numbers of cases now. One of the points you heard me mention yesterday is countries are building barriers between themselves and China, and new barriers are going up in the last days at a time when the cases and the risk from China are going down, and you need access to that expertise that much more. You also need China, and it's getting its productivity going. As you've heard, they're doing a phased restart of everything. So they're getting the factories going, then eventually they'll get the schools going, and then but they're taking a phased approach to try and manage the startup now as they go forward. So for China, there were a number of suggestions about how to move forward, and a lot of it was reinforcing some things that were already happening. But then for the rest of the world, and those were the bigger things that you heard me speak about yesterday, perhaps. But the first thing in the response is there has to be a shift in mindsets. Again, around the world, people are thinking, oh gosh, how do we live with this and manage all this disaster, et cetera, instead of, gosh, this virus is going to come. It's going to show up in our country. We're going to find it within the first week. We're going to find every case. We're going to go after every contact. We are going to make sure that we can isolate them and keep these people alive so they survive the case. This is the way we've got to be thinking. It takes a real shift in mindset. And it's not a preparedness mindset, which usually thinks about how you prepare for eventual disasters. This is going to come soon. Potentially. You've got to be shifting to a readiness, rapid response thinking. And, in China, one of the interesting things was not only did they designate a whole hospital, and these are big modern facilities, hundreds of beds, as, okay, that one's going to manage it. When you go up and think, okay, how do you actually do that in practice? How do you keep it safe? So you go to a ward, if you go to Hoog here or to La Tour, I'm sure most of you have unfortunately had a visit to one of those places. You've got your wards, right, with some doors at the beginning of the ward. Well, what China's done, rather than have some beds that are isolation beds, is at the start of that ward, they've built a wall with a window on it. They sealed the whole thing and said the whole ward, all that whole 40 beds, 100 beds, is now an isolation unit. Just everything at scale, very, very fast. They've taken a stadium, which I saw. They put 1,000 beds up, 72 hours. You've seen these hospitals being built over a week. But they went from, they would convert a training center or a stadium in between 24 and 72 hours. That was the time frame they took in Wuhan to increase by 1,000 their capacity. And it was such a disciplined approach to put that in place. But again, a good lesson. It's okay, we're going to try and not have Wuhans and deal with Wuhans, obviously, but you may have to deal with sporadic cases, definitely. We're seeing that in many places. They get sporadic cases. We're also seeing clusters of cases. And as soon as you start seeing that in places, you have to be ready to manage this at a larger scale. And you have to be ready, in your mind, to stop the transmission change. You have to be thinking that way. And so there has to be the mindset shift, number one, and there's got to be the readiness planning and capacity building, and it has to be done fast. So yesterday when I said, second big conclusion for the world is it's simply not ready. But it could get ready very fast. But the big shift has got to be in the mindset about how we're gonna manage the disease. The third big thing, the rest of the world, and probably this is the first one, is you've got to get your population ready and bring your population with you. And your populations, they should be washing their hands now. They should be proper, hygiene now. Those things that we should be doing anyway should be at scale in countries because they will make a difference to the spread of a respiratory-borne disease. But you've got to bring your population with you. And your population, you want to bring them with you early because things are going to change rapidly, and they've got to have a trust and a way and a machinery to keep people up to date. Yes, we said that. We have new information. Now we do it this way because we have known this virus for 7 weeks. So we are going to have to adapt as we get the strategy rolled out. And the fourth thing I would say, if as we look at the rest of the world, would be access the expertise of China, and they've done this at scale. They know what they're doing, and they're really good at it, and they're really keen to help, even though they are still working in their own areas. And this was another message that you heard all the time in China. It was a fantastic story of the human side. It was always about the people and the individuals. Everywhere you went, from anyone you spoke to. And there was this sense of responsibility and sense of collective action and this war footing to get things done. But the other thing that was striking was the solidarity between provinces, because remember, every province in China has been hit by an unknown pathogen that started to do this in the province. Their response was to get on top of it in their own provinces, but to send medical teams, PPE, everything into Wuhan. When I met with the governors, they said, yeah, we just sent 2,000 people into Wuhan and to work. And you wonder, how does that even work, right? So you go to the stadium and say, well, how does that work? And one of the physicians says, well, I'm from Henan or Guangdong or wherever it was. And he says, we run that, that one I told you that was boarded off. We run that one. They just bring a whole team and run the whole thing. And they bring all their own PPE, all their own equipment. They pull it out of that province. And remember, what we're seeing in the rest of the world is, oh, we better build up our stocks and keep it over here. Oh, we better keep this here. We better keep our, whatever. But there's this sense of you get the resources where they're needed. It's in our common interest to get this down. And you saw all the provinces operating that way. It was really fascinating. So those are the big findings. What China did, the real impact that it had, the implications are you can actually affect the course of this disease. You can change the shape of this, but it takes a very aggressive and tough program. It was a striking thing to see, as in 30 years of doing this business. I've not seen this before, and nor was I sure it would work. So we saw a bunch of other things as well. As I mentioned, there were a number of technical things that we learned about disease severity, the natural history of the disease, how it's transmitted, by the way, even some of the work being done on the animal origin, very interesting. But then also operationally, how do you run a response like that, right? So talking that through with top leaders, how do you set up a stadium in 72 hours and then walk through? You do 1, 2, 3, 4. I mean, well, that makes sense. And then how you run these kind of containment measures at this scale. So a lot of really good learnings that will inform other parts of what we're trying to do with this response. I would say, let me one point, because I know there'll be questions, and I'll stay as long as we need to try and help with any of those. But one of the big questions that we keep hearing about, and you will have heard, is about, how much transmission is going on in communities, right? And you keep hearing the tip of the iceberg, and we can't see this thing, and, there's millions of people infected and all this kind of stuff. So we tried to look at those kind of questions as well. And we, again, you're at war here, and there's a huge fog in any war. You're trying to find those little bits of information that can add up and give you some confidence in what you're saying. So we tried to look at what where was there sampling of people in the population that might give us a sense of how widely this virus was spreading? And again, this is where it's great to look at these things in China because the numbers are so big. But you've probably heard there's something called an influenza-like illness surveillance system that runs around the world with many sentinel sites that collect like 20 samples every month and get them analyzed, et cetera. But this happens in multiple places of China. And what you could do is look at those data, and they could show you, here are our data, our sampling, here's all the flu cases that were coming up. And in November, December of last year, they all went back to look. Nobody, because then once we had a COVID-19 test, they went back to test all of these. Nobody found it. It wasn't there. They found lots of flu. But then in January, they did find it. It comes up in January, the first couple of weeks of January. But outside of Hubei, very rare. One might be positive here or one there. It wasn't like all these samples were positive. Like there was a lot of it circulating. And then another thing we did is in places that were heavily infected, more and more people were coming to fever clinics. They wanted to get tested, et cetera. And in one place, it might have been Guangdong, I think, they had tested 320,000 samples for the COVID virus. 320,000, right? It's going to give you some sense of what's going on. And when they started the sampling of those, about 0.49, I think it was, percent of them were positive, so less than 0.5%. And in the recent period, it's something like 0.02%. So I know everybody's been out there saying, "Whoa, all of this thing is spreading everywhere, and we just can't see a tip of the iceberg." But the data that we do have don't support that. What it supports is, sure, there may be a few asymptomatic cases, and that probably is a real issue, but there's not huge transmission beyond what you can actually see clinically. And that's really important, right? If you're in a war, you will need to be able to see your enemy to know what you're dealing with. Now, another important development in China, just while we were there, was they've just licensed a couple of seroassays that will let them test antibodies in a whole bunch of people to try and get a sense of, if they have antibodies but they weren't sick, the virus was circulating. So, maybe I'll be sitting here next week and saying, guess what? Those data didn't tell us the story. These ones do. But that serosurvey should help us understand that. And that'll be important. For example, you want to reopen your schools. You know that kids have not gotten very sick, or very few have. Have a lot of them been infected? Are they part of the driver of this outbreak? It doesn't look like it. It looks like the main driver is not widespread community infection. It looks like it's household level infection. That may be part of the reason that China's strategy, find the case, because the close contacts are families and people usually know them, and you're going to be able to find them and be more successful. And remember, you don't have to find every single one, because you never will. You want to find enough to break the big chains of transmission, slow this thing down, and get a grip on it. So that's why we went, what we saw was being done, the impact that we believe it had, and how we think it can inform the global response. I want to highlight again, I am not speaking for WHO, because someone may be going, what? But that's what the evidence says. And when you're in a war like this is, we had a big debate with some of our Chinese colleagues about, is this a dangerous virus? Is this a serious virus? Is this whatever? The bottom line is, this virus kills people. You've seen that. And it kills vulnerable people. It kills our elderly. And what we think of as society is how we care for the vulnerable in our populations, not just, and I hear people say, oh yeah, but the young survive, all's good. Seriously. And it is, and that's not always the case either. Young people do die of this disease, as you've seen as well, and they die in industrialized countries. And I think people were also looking sometimes at this and saying, oh, but in China, they don't have this, they don't have that, et cetera. If I had COVID-19, I want to be treated in China. We go into these hospitals, and how many ventilators do you have? 50, 60. I mean, just a scale we're not used to thinking on in the West. And then you'd ask, how many ECMO systems do you have? And I was like, seriously, you're going to ask about ECMO? There's extracorporeal membrane oxygenation, and it's when the lungs simply, even if you ventilate, aren't going to get enough oxygen. And place would say 5. And I remember being with Tim from the Robert Koch Institute, like 5 in one hospital, we don't have that in Europe, and we're using 3 of them to, and we were like, well, people come out? And yeah. So when we look at how dangerous this disease is as well, I think we have to be careful looking at the China data, because China know how to keep people alive from COVID. They're super committed to it, and they're making a massive investment in it as well. That's not going to be the case everywhere in the world. And as you've seen, we've had tragically lost people in, G7 countries are dying of this disease. And so it is a serious disease. And I worry sometimes if we look at the China numbers, people are going to get a false sense of security. These people know and they care about keeping these people alive, and they do it successfully. They're really good at it. So folks, that's what we saw, what we heard, what we think can help inform the global response. It's never black and white, but sometimes we'll present our reportings a little bit more black and white in hopes that it'll drive the discussion about where we go next with the global response. So, Margaret, no one looks interested, so
They look
call it a
hugely
day.
interested. Look, they're all raring to go.
Bernard, I think